Hi everybody, and welcome to the update from the ANU Medical School for today, the 15th of May 2020. As Australia is flattening the curve and restrictions are lifted, I would like to remind you to continue to stay away when you are unwell. Professor Collignon was a co-author in a paper that was published this week, and he has found that a large range of health professionals and educators continue to go to work when they are unwell. It is important, particularly during the COVID pandemic, that we take signs of disease seriously. This is not just about protecting yourself when you're unwell and looking after yourself, but particularly also protecting others around you. So stay at home when you're unwell. I would like to share this with you that I found on Twitter, and this is a message from Canada to those who are working from home. And it really rang true with me. So for those of you who are working at home and who think they're struggling or are struggling or think they're not doing the right thing or not working as well, please read this. You're not working from home. You're at your home during a crisis trying to work. Your personal physical, mental and emotional health is far more important than anything else right now. You should not try to compensate for lost productivity by working longer hours. You should be kind to yourself and not judge how you're coping based on how you see others coping. You should be kind to others and not judge how they are coping based on how you are coping. And your team's success will not be measured the same way as it was when things were normal. Now, we read a lot in the news and on social media about health workers contributing to the COVID-19 crisis, particularly in the States and in Europe, South America. And whilst we see the devastating numbers, and we hear about health workers dying of coronavirus, in Australia that is not the case. It is, however, important to be aware that a lot of us still contribute to the COVID efforts, not necessarily by working clinically with patients who are infected with coronavirus, but through secondment or through advice. We as health workers have other responsibilities or expertise or experience, and this may be in research, policy development, advice or leadership. You know that the director of the school, Professor Imogen Mitchell, has been seconded to Canberra Health Service to lead the COVID response in the ACT, but there are a whole range of us who have either also been seconded, whether it's to the Commonwealth Department of Health or Canberra Health Services, but who are also providing advice, whether it be on policy or ethics, to the services within the ACT and nationally. And whilst the research that has come to a standstill, particularly in the labs across the Acton campus and here at Canberra Hospital campus, there are still researchers who are ongoing in their efforts to find data and to publish it and to find out what coronavirus really means for all. And some of those are from the medical school. I would like to thank all of you who contribute to the efforts, whether you are clinicians working in hospitals or in general practices or in the rural nodes, not just looking after patients, but helping prepare the services for the influx of patients, or whether those of you who have been seconded or who are doing ongoing research. So let's get to the quiz from last week. The pictures I showed you were those of the Goodyear Tire Company and Carolyn Hampton. Carolyn was a theatre nurse working with William Stewart Halstead, a surgeon and one of the big four founding professors at the Johns Hopkins Hospital, who not only was incidental in inventing surgical gloves as we use them these days, but also artery forceps or mosquito forceps. What happened was that Carolyn developed dermatitis using the scrubs that were used during the hand wash that was used during the days of early antisepsis, and William, not wanting to lose her from his theatre team, went and combined with Goodyear and invented the first gloves. Of course, they look a bit different these days. They got married in the end and led a happy life. The winner is Sladjana Gluhovic. Congratulations to the winner. This week's quiz is about this gentleman that you can see here in the background. He's been in the press in Europe over the last few weeks. And again, there is a link to coronavirus, the kind of equipments we use to protect ourselves. And you have to think a little bit strategically, think Semmelweis, Lister and Koch. So I'd like to know who this gentleman is, made it a bit easier. The place that he worked for is shown here in the photo. But where is he from? Where did he work? And what did he help develop? And I'll be looking forward to your answers. And I'll announce the winner next week. So there's some congratulations in order. First of all, to Associate Professor Hussain, who has published her 100th peer-reviewed paper on multimorbidity in older people with intellectual disability. Congratulations, Rafat. That's a great feat. In the professional staff, we would like to announce that Pro Rolf has been successful in gaining the position of the Medical Education Delivery Manager. Most of you would know Pro has been looking after assessment over the last few years and has been our Operation Graduate Management manager over the last few weeks. Congratulations to Pro, and we look forward to working with you. Hopefully Pro can start next week. I've talked before about the impact of coronavirus and the closure of the campus and the labs at Canberra Hospital had on researchers as their research has come to a stop or a pause. We're trying across the university now to work out what the financial impact was or is, and you would have received an email from Chris Nolan asking you to please fill in the losses as you can estimate them, and I'd encourage all of you to fill this out and please send it back to Chris, and we will use this data to assist with recovery planning. Diana Perryman held another HDR forum yesterday that was well attended, and I think this is a great initiative during these days to show some collaboration and engagement and compassion for HDR students and support them during these difficult times. You would have also seen an email from the Dean of the College, Professor Gruen, announcing which researchers had been successful in receiving some college COVID-19 seed funding, and from our school that was Associate Professor Van Haren, combining with the SAGE ANZICS research group, trying to find evidence in Australia and New Zealand during the COVID-19 pandemic on ventilated patients. The media, again, demonstrates the contribution of the medical school to the information that's being sent out there. So Professor Peter Collignon not just published the paper that I spoke about previously, but he's also been in the Daily Mail and talking about recent coronavirus clusters. Associate Professor Sanjaya Senanayake is in the Australian and the 7 News, and I swear I've seen him on CNN the other day, so keep up the great work. Somebody you might not be aware of, but Dr. Sutasa is one of our academics from the Royal Clinical School here in the medical school. He's an HIV physician that's doing a PhD with us, and he's at the end of his PhD, and he's been in the conversation and talking about the differences of rich and poor in Indonesia and how money and self-isolation are linked together. Congratulations. Hot off the press, you may have already seen the email from the Vice-Chancellor giving us a bit more of an update on the dates of the planned return to campus that, as I said before, will be in a phased approach. So as of next week, the 18th of May, there will be access to Acton campus for some researchers, and this is by approval of the school directors and the college deans. Then there's a plan, if things stay as they are, from the 2nd of June for the campus to open for some staff and approved students, and again these will be probably HDR students, and then from the 27th of July, not on the 27th of July, again a gradual return of all other staff and students to campus. From the medical school's perspective for the MCHD, it is likely that lectures and small groups will stay online as long as we can, possibly to the end of the year. For us, particularly important to return to classes, or face-to-face teaching rather, would be to develop a process for clinical skills teaching in year 4, and possibly, hopefully likely, also for year 3. And at the moment we're developing the risk assessment, the protocols, think about the rostering, room availability, timetable, and the cost to that. Across the medical deans of Australia and New Zealand, the schools are all sharing their risk assessment and their protocols for that, and we're making good use of that, and of course sharing what we're having. The minute we know a bit more and a bit more details, I will let you know. We have this week developed some guides. The first one was for students, particularly for them to be very clear on what happens when they are tested for coronavirus, or if they are found to be COVID-19 positive, and what our contribution is to that. And we've also developed a manual for students with instructions on social distancing, particularly with using the spaces here in the medical school, on Canberra Hospital and on Calvary campus. We have amended the academic calendar for phase 2, and that's available on the intranet and on Wattle. We are updating the portfolio and skills logbook, and are now using this to look at assessment further towards the end of the year. And we're also using it to map our learning outcomes to ensure that the learnings that the students have align with those, and of course with assessment as well. Dr. Nicola Skembry and the psychologists have linked up, and the Research School of Psychology will develop a series of videos for us that we can use to learn how to support students a little bit better. The Student Welfare Survey has been amended. It is being sent out every 2 weeks to the students, and it's not just about location and their physical well-being, but also their mental well-being, and it has been amended to ask some more questions about what supports are needed. I have previously spoken about the mental health first aid course, and I think the combination of the Department of Health, medical deans, the Australian Medical Students Association, and all medical schools is really a good example of compassionate leadership. Within our school, we have received funding for 2 years, for 2020 and 2021, to give one cohort the opportunity to do this online course. For this year it'll be year 3, and we're still thinking about which year we will offer this to next year. And for staff, please remember there's the afternoon tea on Fridays. Please attend if you can and have some fun. On other information, there was a meeting this week to talk to others within ACT Health and architects around the Spire building that is going ahead, but also talk about the timings for remodelling Building 4 and when Building 5 will be moving into other buildings. And it looks like this has all been postponed, and we're looking at next year for having to vacate Building 5 and moving into a remodeled Building 4 down in the library space, where we'll have some clinical skills rooms. As you can imagine, the cost of COVID-19 is huge, and within ANU there is a budget model being developed, and we all need to look at our expenses and see where we can make some savings, whilst we have to, of course, spend more money on, let's say, teaching, or have to cover the costs of lost research. There has been a reminder for me from our IT team, please upgrade to Zoom version 5 if you're using the Zoom app. If you're using it through the internet, you should be okay. It gets updated automatically. The AMC, Australian Medical Council, which is the organisation that accredits all medical schools in their teaching, has asked all medical schools to send them an update on the changes that had to be done whilst campuses are off limits for students or clinical placements can't happen. And there will be a paper coming out, or an information coming out on the effects on medical students and medical schools of this once the AMC has collated all this. And it is important for all of you to please fill in your risk assessment form. We will be audited by the university in June, and we need to make sure that all our processes are tight and that we're doing the right thing by workplace health and safety. That is pretty much all from me this week. We'll continue to have our OGM weekly, and I will continue to send you weekly emails. And again, any news, any good stories, any feedback, anything you'd like to see improved or need to know about, please email us on operationgraduate.medicalschool@anu.edu.au. I hope you all have a great weekend, and I'll see you next week. Thank you.